Well, EMS and football, this is going to be the next topic, and I think these two things, are the hobby horse of our next expert. There is hardly anybody who could give us more information. It's Andrej Filipovic, almost Dr. Andrej Filipovic. He told me after I announced him as a doctor last year that he just submitted his doctoral thesis these days, and it's only a matter of days until he's awarded this academic title at the Sports University of Cologne. He then took his PhD with the effect of a whole body EMS, and then this academic knowledge is so very particular about him, and this is also what he shows on the pitch as the ex-trainer and coach of Wolfsburg, and now as a co-coach in Fortuna Cologne. At the Sports University of Cologne, we have got a new study on EMS and football. You included that in your presentation? Yes, indeed. He is nodding his head. Okay, 20 minutes compact. The state of affairs of the research in recent years with a look at our sports idols of the nation, Andrej Filipovic. So thank you very much for these kind words of introduction. I am Andrej Filipovic, athletics trainer at Fortuna Köln, and I also took my PhD at the Sports University, and I conducted two studies, practical studies relating to football and the possibility of using whole body EMS. So my presentation will be about the integration of whole body EMS training into competitive sports, taking football as a basis. So I will briefly talk about the load structure in football, the exertion, why whole body EMS, which are the advantages, and why should we integrate it into competitive sports. And then I will present part of our findings based on the practical studies. I will draw comparisons. I will compare professional footballers and competitive athletes. I will also expand on physical exertion in terms of whole body EMS, creatine kinase, often discussed in connection with EMS, and what the consequences are, what it implies in terms of integration during the season. Then I will move on to practical aspects and talk about my practical experiences and how we integrate whole body EMS into our practice. Compared with individual sports, football is characterized by not only having competition every few weeks, but an intensive competition, and we have to get 100% of the performance of our players. We need, we've got one sample training week based on intensity. We've got polar, heart frequency measurement devices, and the values are given here. What you clearly see is the competition during the weekend is much more intense than what we find during the week, which implies this intense stimulus forces me as a coach to stick to certain regeneration phases, allowing my player to get 100% at the next weekend. If there are a few percentage points missing, it may be decisive for a match. So the Saturday match, on Tuesday we have got two practice sessions, nearly half of what we have during an actual match. And this is what makes it more complex to manage all of this training during the week. We have to make sure that the player gives us 100% at the weekend. And when we talk about an enhancement of performance, we want to avoid and prevent injuries before increasing maximum power and strength. And then when we have a normal training rhythm and intervals without English weeks and additional loads, it's difficult nonetheless to set stimuli. I can not increase the extent. I do not have the time to do it. I can from time to time increase intensity when I increase overall time, and we tried it, is that the footballers respond in a highly sensitive way. So we can increase intensity from time to time, and we have to take into account that we need 100% of a player's performance at the weekend. So why EMS? I compare it with classical maximum strength training, low extent, high intensity levels. Literature has shown that EMS can bring about the same increase in maximum power, just as with normal strength training. And it's a decisive factor to bear in mind. When I compare the two methods, I find that by means of EMS, we have relatively little strain on the joints. There is a lower risk of wrong strain impacting on the joints, and for footballers, highly sensitive areas are the back areas, giving rise to lots of injuries due to the wrong kind of strain exerted on the bodies. And when I can prevent something, well, I can do something about it. Everybody knows maximal strength training, classical weightlifting, etc. I need time to prepare it. I have to work in terms of flexibility until I can do efficient work. When I take EMS, I can then minimize preparatory times. I need 1 to 2 weeks of introduction, and then I can work efficiently. So then, the training period of EMS is relatively short, and this is why I can integrate it without any problems twice a week, without having to increase the overall amount of weekly training. It's a completely different stimulus to muscles, and by relatively little means I can then supplement the structure, the load structure in football, that I can give rise to something new. And even the footballers who have been training and practicing for a long time can increase their performance this way. Now, practical studies. We conducted one in 2012, first study with Fortuna Köln, then playing in the regional league, training under professional conditions, 6 to 7 practice units per week, plus a weekend match. We had an EMS group on the team, 3 times 10 squat they performed, and we had another group, same amounts of jumps without EMS, so that we can the effect out. So we conducted the study over a period of 14 weeks, 2 units per week, between 12 and 15 minutes. We measured it. We did strength diagnostics and jump sprint diagnostics, speed, creatine kinase as a strain value, and then we had indicators for muscular reactions, etc. And we obtained interesting results this way, and I presented it already last year, and I will briefly mention the results again. And then we did it again, a second study at the DSHS, the Sports University, and then we had 3 to 4 units per week, which is much less than the players had before, but a good level. And nonetheless, this was the training extent. And then we had the EMS group, we had a jump group, we had the control group. Intervention period was shortened down to a 7-week period to ensure that we had continuous strain and exertion. In addition to the jump and the strength diagnostics, we had endurance diagnostics. We measured the CK value, muscle biopsy from the upper thigh, for example. Unfortunately, I cannot present all findings. It would go beyond the time frame allocated to me. I restrict my comments to maximum power and then speed. So why maximum power? This is the central component in competitive sports. You know, and there is plenty of evidence for that there is a correlation between maximum power and then a height of, a jump and speed. The higher my maximum power, the higher I jump, the more explosive I am, and the explosive I am, and the faster I am during the first few meters. In football, 45% of the goals are preceded by a linear sprint by the one scoring the goal and by the other one preparing the goal. Well, sprint is part and parcel of it. It's a performance limiting factor in football. In addition, maximum power and strength has got a decisive role regarding injury prevention. And the footballers have got opponents, abrupt stops. They train on artificial lawn, etc. They've got they've got soft pitches, hard pitches, and all of this can change the pattern. And when I've got a well-trained maximum force, I've got much more protection against potential injuries. Here what you see is the maximum power. The first studies measured on the leg press, one leg. Well, based on the maximum, what you can see is that after 7 weeks or 14 units, maximum strength is up. Immediately it increased further. During the trial phase, we had an increase of 20 to 30% after this 14-week trial period. Here, the results of our current studies for comparison purposes. Just to remind you, this was a study, a training extent of 3 to 4 practice sessions per week. This is a high performance level, and this on a professional level at the bottom. What is here visible is it's similar results we find just like in the first study. 2 legs, the extensor at the leg press. What is interesting in terms of football is the back of the thigh, the flexor of the leg, also an interesting increase after 7 weeks. Here, control group, the jump group, you see a small tendency due to coordinative adjustments, but no significant changes. So, as mentioned before, the maximum strength does have a decisive impact on the jump capability, concentric, well, one, and then counter motion jump, braking, and then accelerating again, and then reactive via the fast extension cycle, calf, muscles, jump index, and drop jump index, and via the maximum strength you see a tendency which moves towards the jump, a tendency of a difference in jump values. But after 14 weeks we could find significant increases, not like in the above study after 7 weeks, but only after 14 weeks. And we didn't have a continuous load. We had in 6 to 10, we had 3 English weeks, one after the other, which means 2 matches per week. And nonetheless, we continued our training. And this might be a point why it took longer for one or the other player, that the muscle system was overloaded and that adaptation was retarded, so to speak. Then the results, the findings of our current study. The trend is the same in all 3 methods of jump. Significant increase after 7 weeks in squat jump and counter movement jump. The drop jump, that is the stimulation of calf muscles, didn't show any effects. Maybe after 14 weeks we would have seen a different development. Well, this is based on mere speculation, or whether the jump execution would have developed differently without the English weeks is simply a matter of speculation. And now the muscular strain imposed by EMS, CT, creatine kinase measurements are a common means for controlling, for managing training, often used in football. And theoretically speaking, to simplify it, it's always said that there's little damage to the muscles, minor damage to muscles, and this way CK gets into your blood vessels. The higher the level in the blood, the higher higher the level of damage. Then this is part of literature. There are controversial discussions in this field. I will elaborate on it later. Here, the values from the first studies. We were measured prior to the first unit, then after unit 14, and then in week 14 after the 28th practice session, the EMS group and the jump group. What you see, baseline, that's about 500 values we measure in football, normal training rhythms, 1 match per week, 7 to 8 training units per week, and we measure after intensive training units, we've got between 500 and 700, and after a match we have got values of about 900 to, well, short of 1,000. When we compare it with the data, we can see 24 hours after the EMS training, the CK values go up tremendously, nearly double the baseline value. The same effect is something you can witness in week number 7. You've got an increase from 1,000 to 2,000. Highly interesting in this respect. And often it's described in literature that muscles adjust quickly, that sore muscles will relax, and that the CK value goes down. But here we see increased CK levels well, on a higher level, and over a period of 7 weeks they stayed like that and even went beyond that and went up. And then in week number 14 we find this muscular adjustment, no acute effect, and the values went back to the original baseline. And compared to that, the jump group, a different scale. Well, look at that, 500, 600 constant levels. It tells us that the jump, the variance didn't have an impact on the CK values, and the English week didn't have a major impact on CK levels. These are the result of the findings of current studies we undertake. Actually, we expected that EMS combined with the English weeks has brought about this high-level retention of CK values, but you see identical observations, acute increase to more than 1,000, and they stayed up there till we had the test in week 7 of more than 1,000, and then well, even more than 2,000 in grey, the jump group, and the control group in white. So this fact that the 2 units per week plus a match allow only little regeneration in between these periods. It's like an accumulation of and a summation of the CK values, and they remain on a higher level. Muscular adjustment and adaptation we have seen. Extremely sore muscles after 3, 4, 5 units. Well, after those units, it wasn't there anymore, this soreness, even though we increased the level, but a real adjustment. So that after week 7, we didn't have a major CK change. We couldn't find after week 14, when we changed to a normal rhythm after the English weeks. Then we saw the adjustment. You might think that when a normal player's got an initial value of 500, and when over 7 weeks they are up there at 1,500 or 2,000 CK level, that would speak in favor of excessive strain or a high strain on the muscles. Neither in the first study nor during the second study did we find any muscular non-functioning, where we didn't have anybody who couldn't play due to muscle-related injuries. So we could conclude that these are CK values that may be tolerated by professional athletes or competitive athletes, and that CK is more or less an indicator of muscular stress and strain, but not muscular damage. This is an important point to bear in mind. Now, what can we learn from the practical trials? 2 units per week, in addition to team practice, 3 to 4 plus 1 match, they suffice for significantly increased maximum strength and power. In both studies, after 7 weeks, we had a 15% increase, which is a decent figure. Then we could also see that the jump values are up 7-8%. Then squat, hardly any movements. We didn't see any effects, reactively speaking, after 7 weeks, and that 2 units per week in addition to the match at the weekend are sufficient to substantially increase CK values. That a summation and accumulation of CK values is possible, but that this doesn't necessarily increase the risk of injury. Now let's turn to my work at Fortuna Köln. So much for theory, and I hope it wasn't too boring, but now let's get down to the nitty-gritty. Practical work. We at Fortuna, we've got a MIHA BodyTech device. We use the equipment by integrating it in rehabilitation measures for maintaining maximum power and explosive force. And when a player has to use crutches or has got other problems, that we work for the purpose of retaining muscle strength. Then the main focus is on a combination with strength training for increasing run strength and for speed. Here, Moritz Exlager, after 3 weeks, he had a cruciate ligament torn, and we do our training with him 2 to 3 times a week. We try to do it in a dynamic way, as long as he's not allowed to put a full load on the ligament. We let him sit there, we let him actively treat and work the muscles. As soon as he can stand there and put a load on the leg again, he will in a controlled way further develop via squats, etc. Here, Mike Hegel, this was our first cruciate ligament patient early in the season. We were a bit unlucky during the season. After the cruciate ligament was torn, he couldn't directly undergo surgery. There was some liquid in the knee. 3 weeks later, the op took place, and then we treated him directly. We trained him by means of EMS 2 to 3 times a week. After the surgery, we had a break of 1 week, and then we started again a minimum of twice a week. After 3 months, he hadn't lost any muscle mass. I cannot conclude that the muscles haven't gone, but the indication is that he didn't lose out a lot. So the benefit is when I am to be reintegrated again, if I do have to build up less muscle, then I'm quicker out there on the pitch again. We use EMS quite a lot during practice breaks, because there is a joint irritated, heart, floors, the knee will respond. And when I use additional strength training and squats, I can even increase the pain of the person. So I take this person during these periods, I do the training via EMS, I have a maximum of activation of the muscles, and I can further work on this explosive strength. And then when there is a slight contact of the body, the shoulder gets dislocated of this particular player, that is, he's unable to move the shoulder to do it. And it's a great alternative. No additional weights he has to lift, and he can do the training via EMS. The main focus of our work, the EMS focus, is to integrate it into athletics and strength training, initial speed training. We do not do it with the whole team, but whenever I'm convinced that I can gain a few more percentage points with the player, once they have gone through the strength training program and need a new stimulus, we use this EMS in dynamic way. 80 hertz, 350 microseconds, 4 seconds on, 10 seconds off, and 3 to 4 series and 8 to 10 jump variants. the whole thing integrated twice a week, 1 to twice a week. On Thursday, we have got 2 practice sessions, and we have it as a replacement or as a complementary to strength training, and then once on a Thursday prior to the team practice session, because there we have another 20 to 30 minutes with an athletic focus. And we do it then for guaranteeing transfer of the stimuli to the moving body parts. So at the beginning, we had the Tuesday and Thursday. That's between the last EMS unit and the match. We've got some regeneration time. The players are highly sensitive. They don't want to do too much. The players quickly feel that there are no sore muscles, that the next day their muscles are tenser. This gives them a positive feeling, and so it's no problem that a player trains on Tuesday and Friday, and then Sunday is a day off. On Monday, the regeneration processes are not fully completed. So at the earliest on Tuesday, should a player not be part of the team on Saturday, then clearly on a Monday and a Tuesday to have more time in between the intervals. So this is combined with a classical jump and strength training in the individual training sessions. Variations of squats being done, 3 to 4 series, 3 to 5 reps with higher weights. And then the recruitment patterns are incorporated. Due to the fact that we leave out the electrodes in studies, we could see that the effect is not well the way we wanted. In the X-Tensor, for example, we have isolated training, a drop jump series, or different versions of box jumps or hurdle jumps. In addition, as mentioned before, we have another focus on a Thursday where we have jumps and then transfer it, the strength into movements on Friday, plenty of coordination with something we do for the reactive component, that is the calves, and specifically a few starts of a run, initial run phases. So what I could learn from the studies and my work at Fortuna, this is my recommendation, when I integrate in EMS in professional football, I should do it periodically, 8 to 10 weeks, including a 1 to 2 week introductory period, where I've got 2 units per week, which I integrate, which I bring in to take the sore muscle phase out and give the players the opportunity to get used to it. 2 units per week are sufficient. 15 minutes each, 3 to 4 sets, 8 to 10 reps. Always in a dynamic way, because when a player has got good, coordination, the intensity is not too high. Studies have demonstrated that EMS is efficient because it's in the sub-maximum area and not in the maximum area. Also, lots of studies have revealed that it's not the extent of EMS training is decisive, but its intensity. So if I exaggerate it, I will then take my player out of action for 3 to 4 days. It's better to do it in a dynamic way, and this gives you better intensity control. Combine it with jump training or classical strength training to integrate the recruitment patterns and get the strength transfer into movement and enhance the strength transfer. Very important. EMS is always a supplement. It's not a substitute. I am convinced that EMS is so efficient because in combination with football training, strength training, it brings you a lot. It's not to be regarded in an isolated way. Never ever use it as a complete substitute only for certain times. A player needs additional weights. He needs mechanical strain on the joints. When I increase maximum power, I want my ligaments and my tendons to grow accordingly. That was all on my part. Thank you very much for listening. Are there any questions on your part?